Welcome back to the final episode of ATTV for today. I am your host, Ben McLeod, founder of Convey Bio. I have the privilege of being able to interview the panel from Emerson. Really great to have you here with us, ladies. Nikki and Michelle, great to have you. Can you give me a little bit more detail about your roles within the organization?
Sure. Thanks for having us.
Glad to.
I'm Michalle Atkins, and I lead our life sciences strategy. So making sure that I understand what the customers need in the industry when it comes to automation and higher level software solutions, and articulating that into our organization, and then helping our sales force also understand the needs and our solutions.
Excellent. And you, Nikki?
Oh, yeah. Thanks for having me. Glad to be here. Nikki Bishop, and I'm the Vice President of Marketing and Customer Experience for our life sciences software, which means I have the amazing pleasure of helping develop our portfolio strategy, what's in, what's out, what do our customers need the most, product engineering, customer success, marketing, communications, and get to attend events like this and really understand, what is it that our customers need and how do we make it happen.
Right on. Excellent. So let's jump into it. Obviously, lots of challenges inside of the space. What do you see as kind of some of the main challenges we still need to tackle in the overarching life science industry? So obviously, we're here at ATW, Advanced Therapies Week, but in the overarching life science industry, what do you think some of the challenges are that, again, maybe trickle down to CGT?
Yeah, we focus on 5 main industry value drivers and really frame everything that we do around that. So pipeline acceleration, right, getting drugs to patients faster, real-time release, so making sure that once you've made a product, you can get it to the patient as quickly as possible. There's nothing more frustrating than having it done and waiting for a bunch of analysis or paperwork or all the things, right? You want to get it to the patient as fast as possible. But also operational integrity. You want to be able to make sure that you can consistently make a product and deliver it on time every time, and that you understand how your process flows, which is way harder than you would think. Sustainable operations, right? You can't talk about any industry, I think, without talking about sustainable operations. But pipeline acceleration, I think, is what we hear most about this week.
Right. Yeah, it's been exciting. Even I had a conversation earlier with regards to how the timelines for something like a CAR T therapy used to be something like 10, 15 days. Now we've got some processes that are like 2-3 days. Really awesome to see that with regards to manufacturing really starting to come down. But then with regards to pipeline acceleration, I'd love to get a bit more insight from you, Michelle, about that.
Yeah, sure. I mean, it's really important in this space because the patient is waiting for that treatment. And if it's a new treatment that has not formerly been available on the market, when you're going through that whole process development and clinical manufacturing time frame, you need to be able to understand what the critical process parameters are, what the process steps are, capturing all that information in a way that's easy to transfer. You need to also get information about how do you build the product or make the product. What are the workflows associated with that? How do I make sure that I'm doing the right thing at the right time? And we have a lot of products that actually help with that. So it's pretty exciting to be in this space and help the advanced therapies.
Excellent. Yes, and I understand that one of your products recently won an award. Can we talk a bit more about that?
It did. We're very excited about that. So our DeltaV workflow management won the IoT award just recently, and in very simple terms, that is a way to digitize your workflow. So all the things that go into paper, right? If you could put that in digital, paper on glass solution, meant to be very simple. SaaS solution. We know that customers, particularly in the early stages of development, don't have complicated IT systems set up to take on their own hosting. So making it a simple SaaS solution, get your recipe and information in there and start tracking that digital data as early in the process as possible, so that when you're successful and you get to the point of commercial manufacturing, you are ready and you have tracked that whole process. So we're really excited about it. It is definitely groundbreaking for the industry.
Yeah, it's interesting. It's great that you're providing a product like this, because I remember at the Investor Summit at the beginning of the week, the investors are talking about how many people are still using a paper-based system even in 2025. It's far more prevalent than we like to think. So something like this is very necessary. So can you talk a little bit more about how people can use this to develop and launch their products?
Sure. I mean, I think, one thing that I didn't talk about earlier was like flexible manufacturing. You think about you just said stacks of paper, right? And all these things that get lost. Well, now when you're making 4 or 5, 6 different products and you're trying to switch over, it gets even more complicated. So the earlier you start with a simple solution and start digitizing your recipes and start digitizing tech transfer, the easier, more efficient you get at launching those products, particularly if you're trying to swap between multiple products, multiple lines, skid-based, flexible manufacturing. So starting early with a flexible solution, but helps really advance pipeline acceleration and all of our 5 industry drivers.
Excellent.
Yeah, I imagine you're quite excited about using something like that as well, Michalle, in the different products that you guys are developing as well. It kind of is a horizontal layer that adds on top of everything else.
Absolutely.
Yeah.
I mean, if you think about it, if we think about all the products in our portfolio, we have scheduling capability to be able to bubble up what's happening on the shop floor. The automation that we talked about for actually automating the process steps and kind of being an orchestration layer to help operators have visibility into each step of the process with a unified operator interface. And then additionally, we talked about that process knowledge and process knowledge management when you're capturing that information, and then you are able to seamlessly, or at least be able to send that information about your process down to your manufacturing execution system, your automation system, so that you don't have to manually input a lot of those parameters. So that's quite helpful for getting new products to market.
Excellent. Anything else to add on that?
No, I think she nailed it there.
Perfect. Right on. All right.
We're all about the data. Can you tell? Get your data in there early.
Data.
We want the data. Yeah.
We all love the data. That's great.
Yeah.
And I would say that's actually a theme I've seen so far this week in terms of, automation is great, AI is great, having the data as well that's going to be able to be the gas that powers those other two is of increased importance. So we'll come back a little to you again, Michalle, with regards to CDMOs as well. How can they benefit from these capabilities?
Well, I mean, Nikki already kind of touched on the fact of flexible manufacturing. CDMOs, of course, need to be able to change out products as they're supporting different sponsors. And as you're supporting another sponsor, again, you're going to have more parameters for critical process parameters, critical quality attributes, and being able to input that information into your system easily and quickly. When it comes to the workflow as well, having a simple mechanism for doing some of the more simple workflows, that'd be great. If you are in a more of a development space earlier on, you still want to, again, be able to capture that data, and CDMOs need to do that too. I was in a session today talking with some folks that were like, wow, I wish I knew about that solution. We could have used that a couple years ago.
I believe it. And so I guess based off of what's going on right now, and imagine that we're in the year 2030, what do you think the trends that we're seeing right now that are maybe starting to get a little bit of acceleration? What do you think is starting to what do you think starting right now that's going to be big in 2030?
Well, I have to start with AI.
Yeah.
Of course.
Yeah.
I mean, I think we're going to see more use of AI. The regulations and the regulatory bodies are going to gain more acceptance. We're going to have a better understanding of the best ways to use it, starting simple and expanding from there. Even just using it as assistant to an operator or an assistant to someone that needs to configure a system, for example. Yeah. Those are some really cool places where AI can be effective.
Yeah.
Already. And in addition, I mean, we're already seeing some of that in the discovery and the development phase for products as well.
Yeah, I'm quite excited by it as well, just even in terms of being able to draw non-intuitive insights as well from very, very large data sets, where maybe it's like the combination of 8 different factors that we can't really see, but when you're analyzing the entire data set the way that AI can, it really pulls out something that's quite interesting.
And I think we're going to see the commercial manufacturing side match the answer to AI in discovery. We hear more and more about AI and discovery and gene sequencing and that part of the value chain. But when you think about commercial manufacturing, I think when you said we're in 2030, we'll have an equal match to that answer in 2030 with AI. Because as AI rapidly increases its use in the front end of the process, there are going to be more and more drugs ready to move to commercial manufacturing. And so the commercial manufacturing piece, I think, is answering right now to be ready for that next wave of drugs that are ready to be produced.
Absolutely. All right, Nikki, we'll finish with you. How would you describe your team and their commitment to the life sciences industry?
We are, we call ourselves Team Lifesavers, but I will say anybody out there listening to this interview, if you are, in the industry, you are also part of Team Lifesavers. So let me officially welcome you to the team. It's what we call our internal team, but it's this community, right? It's the energy that's in every one of the rooms that's here. It's the energy in everybody walking around. We do this for one reason: to get life-saving therapies to patients faster, whether that's through automation or AI or the latest bioreactor or services or consulting. We have one mission and one mission only, and that is to get life-saving therapies to patients faster, more efficiently. And it honestly is what we are excited about, what we get up every day excited to do. And so being here, connecting with the community, we're the Team Lifesavers.
Absolutely. I've talked about this a lot, like in terms of some of the different careers that you can pick. It really is meaningful. You can see actual change occurring that's impacting people's lives in such a positive way. So yeah, it's a very exciting.
I got to tell my kids what I was doing here this week, and I got to sound like super cool mom, right? Like, you won't believe what I just saw today. So that's pretty awesome too.
Right on. Well, thank you both for being here. Where can people find you?
Find me on LinkedIn. If you're watching this, you're already on LinkedIn, so find me on LinkedIn. Nikki Bishop. Would love to connect. Let me formally welcome you to Team Lifesavers, so let's connect.
Excellent. All right. Thank you very much. And I guess I'm the only one that's holding you from the cocktail hour now. So thank you so much, guys.
Thank you so much for having us.